How are lipid profile results interpreted in medical practice? Understanding how lipid profile results are interpreted is essential for managing health, especially concerning cholesterol and hyperlipidemia. Let's break it down into simple terms. Lipid profiles measure different types of fats in your blood. The key components include total cholesterol, low-density lipoprotein cholesterol, high-density lipoprotein cholesterol, and triglycerides. Each of these plays a role in assessing your risk for heart disease. Total cholesterol is the overall amount of cholesterol in your blood. Ideally, you want this number to be below 200 milligrams per deciliter. If it is higher, it may indicate a need for lifestyle changes or medication. Low-density lipoprotein cholesterol is often referred to as the bad cholesterol. High levels of this type can lead to plaque buildup in your arteries, which increases your risk of cardiovascular disease. An optimal level for low-density lipoprotein cholesterol is less than 100 milligrams per deciliter. If it goes above 160 milligrams per deciliter, it is considered high, and above 190 milligrams per deciliter is very high. On the other hand, high-density lipoprotein cholesterol is known as the good cholesterol. It helps remove cholesterol from your arteries. Higher levels are better, with 60 milligrams per deciliter or above being protective. Levels below 40 milligrams per deciliter are low and linked to a higher risk of heart issues. Triglycerides are another type of fat found in your blood. Normal fasting levels should be below 150 milligrams per deciliter. Higher levels can indicate hypertriglyceridemia, which also raises cardiovascular risk. When interpreting these results, doctors consider whether the test was done while fasting or not. Fasting is usually necessary for those with high triglycerides or specific pediatric cases. However, non-fasting tests are often acceptable for routine checks, making it easier for patients. Doctors also calculate low-density lipoprotein cholesterol and non-high-density lipoprotein cholesterol, which is total cholesterol minus high-density lipoprotein cholesterol. Non-high-density lipoprotein cholesterol is a helpful marker as it includes all harmful lipoproteins. Risk stratification is another essential part of the interpretation process. Doctors look at other factors like age, sex, family history, diabetes, smoking status, and blood pressure. Risk calculators can estimate the 10-year risk of atherosclerotic cardiovascular disease, guiding treatment decisions. For example, if your low-density lipoprotein cholesterol is above 190 milligrams per deciliter, or if you have diabetes, you may need to start taking statins, regardless of your calculated risk. Elevated low-density lipoprotein cholesterol and triglycerides, or low high-density lipoprotein cholesterol levels, indicate a higher risk for heart disease and stroke. Treatment typically focuses on lowering low-density lipoprotein cholesterol through lifestyle changes and, if needed, medications like statins. After starting treatment, doctors usually check lipid levels again in 4 to 12 weeks to see how well the treatment is working. Lastly, it is essential to identify any secondary causes of abnormal lipid levels, such as diabetes or hypothyroidism. In patients with endocrine disorders, managing lipids may require special approaches due to hormonal effects on lipid metabolism. In summary, interpreting lipid profile results involves looking at various lipid levels and considering individual health factors. This helps assess cardiovascular risk and guide treatment for hyperlipidemia, focusing on lowering low-density lipoprotein cholesterol and managing triglycerides. Regular monitoring ensures that the treatment remains effective and adjustments can be made as needed.